Today we're going to be working with Bonnie, who is a 26-year-old mother who has been having low back pain for the past 2 years. Since it's been 2 years since her mechanism of injury, she's probably in the remodeling and maturation phase of healing, but she's still experiencing some chronic pain, and so today we're going to be using ultrasound with her. Some indications of when it would be best to use ultrasound is if a patient is experiencing pain due to soft tissue dysfunction. And a contraindication to be aware of is you do not want to be using ultrasound on a woman who may be pregnant or is pregnant, so you don't want to be using ultrasound on her low back or abdomen. And so before we start treatment, we'll be asking her that just to make sure. Okay, so today for Bonnie, we're going to be doing some ultrasound, and we're going to want to have the machine at 1 megahertz, and we're going to do it on a continuous duty cycle, and then the intensity we're going to have at about 1.5 to 2. We'll start out with 1.5 and see how she handles that, and then time we're going to go just about 5 minutes, 5 to 10 minutes. Yep. Okay, how's it going, Bonnie? I'm Justin.
How are you?
So you talked about having some lower back pain.
Yep,
and
that is correct.
Okay, and I feel like the best treatment that we can do for you today is doing some ultrasound.
All right.
So what ultrasound is we just use this machine, and we have this little handle. It's got a head on the end of it, and it just emits sound waves into the tissues, which helps stimulate the tissues and decrease pain and promote healing. So does that sound like a good idea to you?
Yeah, sounds like a great idea.
Okay, awesome. And then there's one thing we need to clear, just to make sure you aren't pregnant at all, are you?
Nope,
okay,
not at all.
Great, because that's one of the things we don't want to be using this machine on you if you're pregnant at all. So, okay, and then to be able to get to the tissues, your lower back, I may need to just lift up your shirt a little bit to get to the area. Maybe lower your pants a little. Is that okay if I do that?
Yeah, that's fine.
Okay, great. So can I have you go ahead and lay down on your stomach? I'm just going to lift up your shirt a little bit. Okay. I'm going to put this towel to kind of block your pants so we don't get any of the ultrasound gel on there, okay?
Alrighty.
Okay. So I'm going to squeeze some of this ultrasound gel on your back. It might be a little cold at first, but then it'll start to heat up when we get going. I'm going to go ahead and start. Okay, and just let me know if you start feeling if it gets too hot, or if you start feeling any pain, or if it gets uncomfortable, okay?
Alrighty.
It shouldn't, because we're on a big enough area, so. So we're going to be doing this for about 5 to 10 minutes. Okay. Stop. Okay, how's that feel?
Pretty good.
Yeah? Okay, I'm going to go ahead and wipe off this gel. Okay. Good. And is there any pain or any heat, too much heat with that at all?
Nope, it's perfect.
Still good? Okay, awesome. Thanks.